Well, let's cross live now to New York because we can speak to Lawrence Gostin, director of the World Health Organization Collaborating Center on National and Global Health Law, also a professor at Georgetown University. Professor Gostin, thank you so much for speaking to us. When it comes to those scenes that we're seeing across the affected places in China, Wuhan in particular, is that the right thing to do, to completely close down, to lock down those people that could potentially be affected?
You know, it's utterly unprecedented in the history of the world to confine more than 50 million people. It could only happen in China. And I think it could end up being very counterproductive because, as your story indicated, people are stuck there. There's fear, panic, uncertainty. They are literally trapped in a zone of contagion. And they're going to infect one another, and eventually they will leave. So I think the first rule of public health is to gain the trust and the cooperation of the population, and this is just the wrong way to do it.
So given that this is more infectious, this coronavirus is more infectious than SARS, what should people in these areas be doing? What should the Chinese government be advising?
Well, the Chinese government should, first of all, be in the community, in households, in community venues, doing testing, screening, treatment, and trying to find out who's exposed, what's called contact tracing. That's how we brought SARS and MERS under control, and indeed how we brought Ebola under control. And they should really have community health clinics, and really deal with this in a public health way. I would love to see them call in international experts like the WHO, Public Health England, the US CDC. Imagine what that would signal. We would put aside our political and ideological differences and we'd come together as a common humanity to fight this global threat.
Given how the Chinese authorities dealt with SARS, there was a lot of secrecy about this. Is this not a more positive way? We are getting information out from China, from the government regarding this. Are we not seeing a more positive treatment to this?
Well, certainly China hid SARS for weeks and months before they let it out. This time, literally 3 days after the virus was first reported, they had genetically sequenced the virus, and the Chinese officials shared it with the full international community. That's magnificent, and it could lead to rapid development of vaccines and medications to bring this under control. But on the other hand, it's very clear indeed that there are parallels to SARS in that the Chinese were very, very slow off the ground. There were millions of people that left Wuhan and Hubei province before a response was undertaken. And it appears that the officials in Hubei and Wuhan were afraid to do anything without clearance from Beijing. So critical days and probably weeks went by when the virus was spreading. I mean, now it's on at least 4 continents and nearly 20 countries around the world. So the geographic spread is far greater than it was with SARS.
Professor Gostin, thank you so much for your expertise. Thank you so much. We'll be coming back to this story a little bit later right here on Newsday. But now let's bring you up to date with some of the other news stories. President Trump's impeachment trial has moved into a new phase with senators submitting questions to lawyers for each side. Now, the White House is trying to block publication of the former National Security Advisor John Bolton's book, which claims that Mr. Trump actively withheld aid to Ukraine. Adam Schiff for the Democrats made the case that Mr. Bolton must be called as a witness.
There's no way